Okay, let me simply introduce ICON. ICON is a BC emergency digital emergency program. Is conducted by Dr. Kendall Ho. It's been gone on for 17 years, and it will give to multicultural community patients and the family, giving everybody the chronic education, prevention, and self-management, and through the health webinar and also using online information, it can increase the patients knowing the management and also the lifestyle and also prevent and reduce the risk. And also at the same time, it would promote communication between community members and health professional, and also optimize the people's knowledge of digital information and improve their life quality. Okay, well, so today we have many speakers to talk on many topics. This is to strengthening health and wellness as we age, to understand frailty. This year, we only had one webinar just for one day. Today, we arranged for 3 hours to broadcast here. Our Q&A will be postponed to August 19. Please pay attention. But today, you still are able to pose your questions. Okay. Today, we are very fortunate to have many medical VIPs talking to us many aspects of frailty, to share resources, and also as we age, to strengthen our health. And we have Dr. Thomas Ho. He's a family doctor. Amy Yu, she's a registered dietitian. Wendy Lam, registered occupational therapist. Nicole and Emily Peck, registered physiotherapists. Dr. Tigerson Young, clinical psychologist. Ken Lin, community pharmacist. Winnie Lau, registered psychiatric nurse. Thank you to all of you to take time from your busy schedule to take part in the webinar. Okay, following this, we will have 2 physiotherapists. Wendy mentioned earlier the most important for prevention is to do exercise. Today we are glad to have 2, Nicole and Emily. Emily Pat and Nicole Tai, they are both physiotherapists, to go through with us as to how we can strengthen our body and prevent frailty. Hi, everybody. We'll talk about exercise. Our objective today is to talk about, yes, we will talk about the advantage of exercise. We have to, let's introduce ourselves. Okay. Okay. Maybe we had some slides. We had our pictures, but you can see. I'll talk about ourselves. I'm Nicole. I'm a registered physiotherapist and also a registered needling expert, and I am helping people to do the muscular injury and training. Hi, I'm Emily Pat, and I'm also a registered physiotherapist in Canada. Okay. I said so earlier, what's the advantage of doing exercise, and how do you prepare the exercise, and how to prevent injury when exercising, and also using assistive devices to help us do some exercise. Okay, I want to ask you, do you have any low back pain or shoulder pain or neck pain, knee pain, stuff like that? Maybe you have, or maybe you have some high blood pressure, cholesterol, diabetes, respiratory disease, or osteoporosis. Actually, seniors have a lot of different conditions, also bone issues. A lot of times the doctors say doing exercise is good, but how to do exercise safely and how to be healthier. Actually, when we do exercise, do regularly is very good. It would help seniors in many areas to improve. Doing exercise, apart from improving physically, it would decrease stress. It would also improve our general health, improve circulation, increase our immunity so that we don't get cough and cold so easily. And some people feel that actually exercise could bring about weight loss. That would also reduce stress for our joints. As we age, actually there are a lot of changes in terms of bone. Maybe it would get age and also osteoporosis, and our heart health, also cardiovascular. There might be some changes, and maybe some stiff and also not meaning the index or immune health may decrease. Actually, in many areas, we have to improve how to prepare to do age-appropriate exercise. In terms of exercise, there are four major ones. One is endurance, aerobic, cardio. Second one is strength training. Third is balance training. And lastly is flexibility. Actually, what is aerobic cardio? Actually, is something that helps with our cardiovascular exercise health. When we're doing, you can feel that your heart rate goes up, and the intensity is from moderate. That means when you're exercising, you can still chat, maybe with some difficulty, to vigorous. That means when you can't chat, you're panting, some difficulty, you can't talk. So between moderate and vigorous, that's good. And every week you have to do 150 minutes. You can split into several days. That's our objective. And when you do exercise, actually it's good for your cardiovascular and lung. Is very good. And when we do our house chores and going upstairs and downstairs is very good. It's very important. Third one is muscle strengthening, and there are two types. One is a muscular strength and muscular endurance. What is the muscle power? When you do some weight, you can raise 6 to 10 times before you sit down. Muscle endurance, lighter weight, but you can raise more. Both of them would do the muscular training, because sometimes we have to use our muscle strength and inner strength, and you do 2-3 times a week is good. Could do pushing, pulling, and reaching. You use major muscles, and sometimes the chest or your arm muscle is all important. Actually, when we have healthy muscles, when we do something that we like, landscaping, looking after grandkids is simpler. and also it helps with our bone health. The third one is balance. In terms of balance training, actually is very important for seniors. You can do it every day, and you challenge yourself. Standing on one leg or holding furniture or table to stand on one leg, increasing our balance, stability. Once we are well balanced, it's not so easy to fall. And lastly is flexibility. Actually, our flexibility we can do it every day. We can do some bending, reaching, so make our stature and our lower limbs could be more flexible when we carry things or do something movement like housework. Is harder to get pulled or strained. And if every time, if you have friends who have not started exercising or seniors, you can try this 8-week walking program. Actually, in the 8 weeks, maybe 1 week you do 3 times. Each time you do 15 minutes walking and slowly. And every week you can increase the number of times or increase the time, but not to increase both at the same time. Because if you do that, it would be hard for your physically, and then maybe you can't finish 8 weeks and you say not to do anymore. You can start with 15 minutes 3 times a week, and then increase to 4 times a week, and then you increase length, increase to 20 minutes 3 times a week, 4 times a week, and then you can see there's a 8-week program. There's a start. Apart from the one exercise, actually you can do other Tai Chi, Qigong, or tower dance. Is very good to do. Or like chair yoga is suitable for your seniors too. Okay. Doing exercise to seniors is good, but the most importantly, we have to make sure when we are exercising, we don't get injured. And then I'll tell you, apart from exercising, you can be safe too. First of all, you have to remember before doing exercise, you have to do some warm-up, and after exercise, you have to cool down. Like for pulling exercise, or you move your legs, you will warm up your body. Not so easy to get injured, and also you have to be careful. Avoid extreme weather. If it's too hot or too cold, don't do exercise. Pick some warm time, not raining. Do some outdoor exercise. And you do indoor is safe. And when you do exercise, you have to drink water to hydrate yourself. Otherwise, when you perspire too much, you might be dizzy, or you get sunstroke, or you have to eat some carbohydrate like fruit juice or Gatorade or cookies to supplement. Actually, there are some indexes for you to check to see your exercise extent, whether it's proper. That this rating of perceived exertion. 10 is too much exertion, like you almost faint. We don't wish you go to that. So our aim is between 5 and 7. When you're exercising, you can feel that it's a little hard. You are a little tired. That's enough extent. And also, when you have to know how to rate your heart rate, we can put 2 fingers on my wrist, close to my thumb, and you can feel the pulse and look at the watch. In 15 minutes, what's the rate? And you time that with 4. That would be your heart rate in a minute. Our objective is use this formula: 220 minus your age and minus your stationary heart rate. Let's say if you're 65 and ordinarily when you're sitting down is 60, then you 220 minus 65 minus 60, and that's your reserve heart rate is 95. Okay, and this is very simple talk test. Different levels when it's light, you can very easily sing and talk. Moderate, you can talk, but it's a little tired, you can't sing. And when it's vigorous, you don't have enough air to talk and sing. As a senior, I suggest you do the moderate level. That's good enough. You can exercise and chat, but talk, but can't sing. That's the appropriate level. Okay. As for seniors, the legs may be not so strong. You can see some seniors, they use assistive device to help. Actually, different types of devices, depending your doctor and recommendation. We can see which assistive devices help you, like some canes, walker, for wheel walker with wheel the rollator, or also wheelchair.
So a brief introduction to these walkers and their advantages. When you have the walkers, some have wheels, some don't, and then up to your therapist to decide which one is better. So this one, it provides two-sided walking support. When you don't have the strength, you use these walker to help you. When you walk, you can you use this walker. Then if you have the wheels one, then you can just push it forward, and then you just push. If you just push and fall, just push and walk, it's easier for you to fall. If you don't have that much strength in your legs, then you can try a walking cane. And this is a single-sided walking support. And if you're weaker in the left side, and you just have the walker on your right-hand side, and then other people won't bump into you, and that's safer for you to walk. So, and let's do some exercise now together. So let's give you a demo how to do exercise at home. And we don't need that too much equipment, just some things that you have at home. Can you see us? Yes, you can see us, right? And for example, at home, you can get 2 water bottles, and then let's do like develop our strength in the arms. You can do things like this, up and down. So we are developing the muscle there. And we can also try to go like this. Yeah. Like this. And you can pause for 5 seconds, and then 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And then we use bottles to to work on our arms. And now our legs and weights, you can get some support from a piece of furniture, and then you go slowly like that, and then you squat, and then you get up straight, and make sure you have a piece of furniture to give you the support. Don't use the chairs with wheels. It'll go like that. And also, you can sit on a chair, and that's also something you can do to develop your strength in your legs. You sit like this, and then when you get up, you just lean forward, and then you get up. And then you lean forward, and then you sit down. And then one more time, you lean forward, you get up. And then you lean forward, you sit down. When you need some support, you can use the arm support. And now we can do it together. And then our try something else. You find some support like a piece of furniture, and then you look at the position of your feet. Your feet goes like that, and you are now strengthening your lower legs. See, up, down, up, down. Yeah, so developing stronger lower legs. And then if you are confident enough, you can try this balance exercise again with some support from a piece of furniture, and then lift your one feet, and then if you are confident, and then you can try you go without the support. Otherwise, you can rely on the support, and you lift one foot, 1, 2, 3, and then you put it back. The other side, do it the same thing. 1, 2, 3 seconds, and then put it back. Now, we are still standing, but this time we can go like you're marching. You go up and down, like you're marching. So you can do repeat this for 10 times. Marching. So this is what we are working on your upper legs, and then make it more challenging. Let's do. If you are confident, you can go like this. Yeah, your right hand, your left knee, your left knee, your right hand. If you're not that confident, you can sit on a chair, and you can make your left hand right knee, right hand left knee. Now we are working on your hip muscles like that. So are you okay with this exercise? And now let's try one more. It's a balance exercise. We can stand up, and then we go it's like you're dancing. You go to the left, your left side, your right side. You're just walking, yeah, sideways. Good exercise. Do you enjoy this exercise? And make sure when you do exercise at home, make sure it's safe and there are family members beside you. Yeah, don't do too much that it's too challenging. Safety is number one, and then make sure it's safety and health. And thank you so much. Thank you, Nicole and Emily, for your demos. And I guess we can benefit a lot from your demos. So exercise is very important, but also make sure it's safe, and then you go gradually. not in a haste. And when we age, when you have the chronic diseases, you have to take it slow. Yeah, don't rush. Make sure you don't just always always sit still. Try to make sure you have physical activity every day. That will be good for your strength in your bones.
There's some upcoming events. We are busy in July, August, September. In July, we have 2 dates that's been scheduled. One is July 12th, one is July 22nd, both in the morning, 2 different webinars. Is to do with the summer extreme weather series. One is managing chronic kidney disease during extreme summer weather. The second one is chronic disease management during extreme environmental conditions and wildfires. And also in terms of respiratory system, we have 2 speakers to talk to us. And that's in July. In August, Tuesday, August 13, using apps to support your health. We also have Wendy, who talked to us today about fall prevention. She will talk about that topic. And on August 19, we go back to today's Q&A session. If you have any questions, you can write them and send them to us. We will arrange for speakers to answer all the questions raised. And in September, that's our annual the Success Health Fair. That's on September 15 on a Sunday. It's an all-day activity. ICON arranged for 2 speakers. One is specialist doctor to talk about chronic pain management, and the other speaker is family doctor to talk about using apps to support your health. I hope you all will pay attention. And your way of contacting us, there are many ways. You can see those on the screen. Keep in touch with us if you are subscribing to our the newsletters. You can join in this email correspondence. There will be, when there's a webinar or other activity, you'll be informed directly. ICON, thank you very much to the Patient as Partners Initiative support, and also we are thankful to our community partners. Thank you to our media partners. Thank you to all the viewing hubs community partners. Lastly, we are also very grateful. Thank you to our speakers today, including Dr. Ho, Amy Yu, etc. Lastly, we have to thank all our several interpreters behind the screen doing the interpretation for us, Shiny, Susan, Linda, Adam, and also thank you, MB Interpretation Services. And hopefully next time when we have the webinar, we'll meet with you again.